This is Matthew Stack with Trauma and Addiction Solutions, and thank you so much for joining me today. And today I want to talk about the really important topic of insomnia. And this is the first in a series of 4 videos that I am producing on insomnia. Today we're going to talk about background, some definitions, and something called secondary insomnia. The next video is going to be on sleep hygiene. The third video on sleep association, or something called stimulus control. And then the last video is on sleep efficiency or sleep restriction. And these videos are really intended to be watched together. They're brief, and so I do hope that you'll take the time to watch all of them. But for today, I want to just start out by letting you know that insomnia is one of the really most common reasons why people will see their primary care doctor, very common, and then also a common symptom for people that come to see me for their psychiatric care. And insomnia really has a bi-directional relationship with mental health. And by that, I mean many people with mental health issues like depression or anxiety disorders will have insomnia as a symptom, but chronic insomnia can actually cause or worsen mental health issues. So people can have decreased attention, be more depressed, more anxious. I've actually seen people with really bad sleep deprivation become psychotic, actually, and have hallucinations or delusions. So it seems like the brain really needs good sleep on a consistent basis in order to be healthy and function well. And we estimate that anywhere between 10 to 15% of the population has insomnia at any given time. I want to talk about some definitions today. Insomnia is regarded as having difficulty sleeping 3 nights a week for 3 months. That also then has daytime symptoms, such as falling asleep during the day, lack of concentration, etc. Other words that you'll hear when talking with your doctor about insomnia, you can have sleep latency, which is the difficulty falling asleep. You can have frequent waking. You can have early waking. And, these are different presentations of insomnia. Another thing that we should do is distinguish between insomnia and not sleeping well. That's kind of a choice. So, for example, let's say that I have to get up to go to work at 6, but I choose to stay up till 1:30 to watch YouTube videos. The fact that I didn't get much sleep is not insomnia. That was my choice. But if I went to bed at 10:30 and couldn't fall asleep until 1:30, that would be significant sleep latency or difficulty with sleep onset. That would be more insomnia. We also should talk about the difference between primary and secondary insomnia. These definitions have fallen out of favor a little bit, but I think it's still relevant to illustrate a little bit here. Secondary insomnia is when there's another medical condition that is causing the insomnia. And the idea is then if you can identify that other medical condition and treat it, that would actually help your sleep improve. Whereas primary insomnia, there's no other medical condition that's causing the insomnia other than insomnia by itself. And the reality is that a lot of people can have both, and that's why we don't use that terminology quite as much. People can have these secondary causes of insomnia, and even after you treat them, they can still have insomnia that needs to be dealt with as well. There's lots of consequences of this chronic insomnia. People can have actually impaired cognition. There's been studies that have shown that increasing amounts of sleep deprivation is parallel to increasing amounts of alcohol in terms of your cognitive focus, your reaction time. And so people can really actually be quite impaired as a result of sleep deprivation. There could be an increase in automobile accidents. People can fall asleep at the wheel, drive over the median line, miss an exit, for example, and there can be increased risk of accidents at work. And the other thing is that people can actually have other medical conditions that result from the insomnia. And so, for example, we've realized that there's a relationship between insomnia and obesity having to do with uh, hormones, the hunger hormones that are influenced by our sleep, to the point where people that have chronic insomnia are more likely to actually gain weight. And this can lead to other medical problems such as diabetes, for example, and obstructive sleep apnea. Let's talk about some of the medical conditions that can cause secondary insomnia. Some of them are fairly obvious. If a person has a lot of sinusitis, upper respiratory congestion, they can't breathe very well at night, that's going to make difficulty with their sleep. If a person has a condition called congestive heart failure, it's well recognized that these people, when they lay down flat, have difficulty breathing. It's called orthopnea, and they wake up suddenly, gasping for air. And many of these people have to sleep in the lazy boy chair and recliners, or prop themselves up with pillows in order to get a decent night's sleep. People can have gastroesophageal reflux disease, where the stomach acid comes up into their chest, their esophagus. The stomach was designed to hold acid, the esophagus wasn't. And so if people have stomach acid coming up into their esophagus and throat throughout the night, that's going to make them cough, burning pain, and they'll wake up. People can have restless leg syndrome, jumpy, wiggly legs during the night that wakes them up. Men can have large prostates, incomplete voiding when they go to the bathroom. And so then they end up having to wake up and go to the bathroom multiple times during the night because of the large prostate. People that have neurodegenerative diseases such as Alzheimer's can have impaired sleep architecture. This can be like a sundowning syndrome. Also, just chronic pain. If somebody has osteoarthritis, degenerative disc disease, impingement on the nerves in their neck or their back, and then low back, and then they get burning and tingling pain into their hands and their feet. This can disrupt their sleep. Medications, there's certain medications that will affect your sleep. And then also, circadian rhythm issues. So people that work different shifts, people that travel a lot and are in different time zones, your sleep can be disrupted this way and can induce insomnia as well. Now, I want to talk also about psychiatric conditions that will affect your sleep. It's well recognized that insomnia can be a symptom of depression. People that have a lot of chronic anxiety and sympathetic nervous system is dysregulated all the time can have a hard time sleeping. People with post-traumatic stress disorder often can have bad nightmares and can wake up panicky and their heart racing and sweaty and tremulous. And we can use medication to help with the nightmares, which helps people to sleep better. I've seen people with bipolar disorder who are slightly manic. We call that hypomanic. And a lot of times I've tried many different sleep medicines with these people, but it wasn't until I actually treated their bipolar disorder better, help them to not be so manic that they actually started sleeping better. People that have substance use disorders, like alcohol use disorder, that will disrupt your sleep architecture. Initially, alcohol, can make people sleepy, and a lot of people will use it to help sleep. But over time, people can actually have more difficulty sleeping, especially when they don't use the alcohol. Their brains don't know how to sleep without it. And so that can be difficult. And then obviously, if a person has a psychotic disorder, they're hearing voices during the night, they're paranoid, they're going to have a lot of difficulty sleeping. Well, folks, the hope is that if you do have one of these other conditions, either medical or psychiatric conditions, that as we treat those conditions, we'll be able to help you sleep better. So it's real important to work with your medical provider to identify these other things, rule them out, treat them on the path of helping you get a good night's sleep. I do hope you'll watch my other videos. I think they'll be very informative. These other techniques are cognitive behavioral therapy for insomnia. There's evidence that can be as helpful if you apply them in your life. They can be as helpful as a sleeping pill for you. So I would encourage you to watch the other videos. This is Matthew Stack with Trauma and Addiction Solutions, and I'm wishing you wellness in your body, your mind, your relationships, and your spirit. Thanks for joining me today.